If your fasting sugar and HbA1c are normal, your metabolic health is fine.
No, can be very misleading. This is a screenshot. It tells you, what's happening in your body today. So I want to know what's happening the remaining 364 days of the year. I want to actually pick it up before your report looks abnormal. That's truly preventive medicine.
And how do you do that? My guest today is Dr. Vishakha Shivdasani, a medical doctor whose work brings together recreation, lifestyle, health prevention, and disease reversal.
I don't wait for an HbA1c to be 6.2 for you to be labeled as a diabetic. Honestly, that's failure at my end as if I'm your doctor. I understand the trajectory and I know you've got metabolic dysfunction brewing and I know you're heading towards that. So before that happens, I need to tell you, hey, listen, you need to else, given a year or 2 years, you are going to be diabetic. You can't out-exercise a bad diet, you can't out-supplement a bad diet, and that's the truth. Genes, like you said, load the gun, but whether the gun is going to be fired or not, that is your epigenetics. And that you have sole control over. We just normalize aging when you're 40 or when you're 50. Aging happens, but the aging problems are not meant to happen. Copious amounts of hair fall. If your weight is the same, but your abdominal girth is increasing, and you're working out at the gym, but unable to drop it. If your periods are suddenly becoming either 20 days or 30-40 days, red flag. Your body will always tell you and always give you signs before it manifests into some big disease and shows up on your blood report or in your own body.
Welcome to the Dr. Aditi Govitrikar show, Dr. V, as you're popularly known. Let's talk about preventive medicine. Today, what happens is that I go do my annual checkup and I see the reports and I think this is good. Annually, I do one test, a barrage of tests, and that's it. What do you have to say to this?
First of all, thank you for having me. So, as a preventive medicine specialist, I don't look at that yearly investigation as your true health parameter and your true health status as of today. This is a screenshot. It tells you, what's happening in your body today. In preventive medicine, I want to understand the trajectory. So I want to know what's happening the remaining 364 days of the year. It's not that one day. So I want to actually pick it up before it shows up on your report, before your report looks abnormal. That's truly, preventive medicine.
And how do you do that?
So for instance, if you see reports like HbA1c or, your liver profile, your blood sugar level, this is all part of any regular annual check. I don't wait for an HbA1c to be 6.2 for you to be labeled as a diabetic. Honestly, that's failure at my end as if I'm your doctor. If I'm seeing your last year's report is say 5.4, this year's report is 5.7, 5.8, I understand the trajectory and I know you've got metabolic dysfunction brewing and I know you're heading towards that. So before that happens is when I need to tell you, hey, listen, you need to do something about it now. Else, given a year or 2 years, you are going to be diabetic.
What are the signs or symptoms that we, especially women, say that, this is normal, I don't need to look at it. But according to you, these are red flags. This is something that you definitely need to pay attention to.
Yeah. So that's a great question because I see this happening all the time at the clinic. Women especially normalize not being optimal. They'll say, chalta hai, this is, I'm in my 40s. I have kids in the house. So, I'm a parent running out after children. So I might be tired because of that. So to answer your question specifically, it's chronic fatigue, for instance. And they'll say, no, but I've got 2 kids and I'm running after them. So maybe it's that. Or sleep disturbance. I'm not being able to sleep very well. And I'm not talking about a one-off day sleep. I'm talking about over a period of time. I'm unable to sleep at all. But I've heard this happens, in your 40s or when you're a menopausal, perimenopausal woman, so must be because of that. Or my waist size is just not going down and my girth is increasing. But again, must be a hormonal problem. So it's all right, So they will blame it either on their work stress, on their house stress, on their age, on their hormones. But if you are having copious amounts of hair fall for no reason, if your weight is the same, but your abdominal girth is increasing, and you're working out at the gym, but unable to drop it, there's a problem. That's a red flag. if your periods are suddenly becoming either 20 days or 30, 40 days, red flag. I'm not talking about a one-off month. I'm talking about month on month over a period of time. So you can't normalize these things. These have to be addressed. You can't say my neighbor also has this problem, or my mom also went through this. No, this is your body giving you, talking to you. And I'll tell you, Aditi, I've seen thousands of patients, and I can tell you after almost 20 years of practice that your body will always tell you and always give you signs before it manifests into some big disease and shows up
Yeah.
on your blood report or in your own body. So you have to notice these and then say, I need to do something about this because this is not normal anymore. So the question to ask is not, is this normal for everybody, but is this normal for me? Has my strength declined compared to what it was 6 months ago? We just normalize age, as aging. When you're 40 or when you're 50, you think that this is meant to happen. No, it's not meant to happen. Aging happens, but the aging problems are not meant to happen. So you need to look at those patterns. The patterns are very important, not a one-off, and then address those.
What about the other things which are, for people who are very hyper or very anxious? For them, what would you say? Okay, this is okay. This is related to Of course, not. I'm not saying that don't take any treatment for it or don't look at it, but it is not such a big deal as one thinks it is. Is there anything like that?
Well, if you're going to skip a period, a lot of people get very nervous when they skip a period, right? It's okay. It's normal. I think if you ask any woman in her lifespan, that span, there'll be at least 2 or 3 times where she would have missed a period here and there, not being pregnant,
Yeah.
It's all right. These things happen. But like I said, if it becomes, you have to notice patterns. That is key. That is the most important thing. So one-off things, if you just let them go. If you're going to have a one-off headache here and there, you can't imagine how hypochondriac people get. They come and they say, I've been getting a headache. I said, getting a headache means how long has it been persisting? 2 days. I'm like, and what do you think that's happening? What's happening to you? You think it could be a brain tumor?
Tumor, yeah.
I'm like, no. But, my uncle had it or someone else. I'm like, that's not going to happen to you. So while it's one thing to say don't normalize, because 2 things happen when you're fearful. One, you can become a hypochondriac. The other one is you just shut down and you say that I'm not going to address it. I'm not even going to look at it.
Denial.
So deny it.
Yeah.
So you don't want either of those 2 to happen. You just want to be absolutely aware. So small things, let them go. When they become patterns, then you do something about it.
In your practice, what is your recommendation for a person to do blood tests? Is annual checkup fine? That's one part of it. And the second part is, if one sees any sign or symptom by themselves, what are the tests that you recommend? That, okay, this is a red flag, just get it done anyway.
So first, of course, I will ask for a basic executive profile, right? Because there's this myth that doing more tests means better healthcare.
Yeah.
I don't think that's true. So you need to do the tests that are relevant to you, relevant to your genetic, history and all of that. So first we just ask for a basic. So it'll cover your liver profile, your lipid profile, kidney profile, vitamins, CBC, basic things, HbA1c. Then if I see, like I said, your blood sugar is going up or your HbA1c is creeping up or your cholesterol is elevated and you have a family history, say of heart disease, or if you have a family history of diabetes, then I will ask for specific tests which must be done. Because knowing those numbers, you can actually prevent someone from getting a heart attack. You can prevent someone from, developing type 2 diabetes. So if someone, say, with a family history of heart disease, I will ask for an LP little a. I will ask for an ApoB before telling the patient to do, an angio. I might even ask for a CT angio, but more specifically the calcium score. So I might ask for that. If I find those numbers are elevated, then I know how aggressive I need to go with the patient with medication. Or I can say, no, just lifestyle intervention is good enough. But that gives me a mirror into more depth into what's happening. So those are important numbers. Your insulin number, if it's creeping up, then again, I have to give you medication or not give you medication based on those things.
Yeah. So we spoke about family history and how important it is to know what the history has been. However, what I also see is the fatalistic attitude that my mom had diabetes. I'm going to have diabetes. Why should I even think otherwise? What is your advice to these people? How can you completely prevent diabetes or any lifestyle diseases that the parents have had?
It's such a good question. There's something called genetics, there's something called epigenetics. Genes, like you said, load the gun, but whether the gun is going to be fired or not, that is your epigenetics.
Yeah.
And that you have sole control over.
Yeah.
So, what is epigenetics? Epigenetics is everything we've discussed. It's the food you eat, it's the way you sleep, it's your gut health, it's the supplements you take, it's your movement, your exercise. So that can actually determine whether you're going to be diabetic or not, whether you're going to have heart disease or not.
Yeah.
There are so many studies now to show that epigenetics is 80% and genetics is only 20%.
Yeah.
So I tell every patient who comes to me, if we have to look at, we're the diabetic capital of the world.
Yeah.
So then everyone, if I step out of this room, half of us will be diabetic.
Correct.
You can't live life like that. You have to see what I can do to prevent it. And that's totally in your control.
Why do we call diabetes a villain? Why is it such a bad disease?
Because it affects every single organ of the body. You pick the organ, and that's what. So whether you have diabetic retinopathy, you have Alzheimer's and dementia, you have heart disease, you have neuropathy, you have kidney disease, there's nothing that it spares. The sad part of it is, I would say out of 10 people, 9 of them can control it. Even the ones who are far gone. I'm talking about complications. It's completely in your hand. So you can totally, if not reverse, you can at least make sure you don't get there to begin with. And now we're getting there even vis-a-vis fatty liver.
Yeah.
Because like I said, they're all different chapters of the same book.
Yes. Yes.
Right? We see so many kids with insulin resistance, then PCOS. Those kids with PCOS have diabetes later. Then you have infertility issues in between.
Yeah.
So they're living a whole life of disease for something that is largely preventable.
Yes.
Right?
Yes.
And that stems mostly from chronic inflammation.
Yeah.
And to put chronic inflammation into remission is totally in our control.
We are talking about chronic inflammation. Now, inflammation is typically a response that your body gives to something that gets triggered, which is not good for you. What are the different types of inflammation? What are those which you need them to survive? And what is it that one needs to look at and say that, okay, this is a red flag?
So we have 2 types of inflammation. You have acute and you have chronic. Acute inflammation is not just good for you, it's life-saving. For instance, if you have something in your eye, a foreign body, right? Your eye will start watering. Yeah. That's your body's response, so that it gets rid of that foreign body. If something gets stuck in your throat and you're violently coughing so that you don't choke to death, or if you're bleeding, your body will go and form a plug there so you don't bleed to death.
Yeah.
That is all acute inflammation, which we need. So we're not interested in, putting that into remission. Absolutely, absolutely. The thing is, when the offending agent, be it the foreign body or, something that is in your gullet or something that's caused an injury, if that is not there, but your body is still fighting something, but there is nothing there, right? So we don't know what that something is. And that inflammation then has not come down to baseline level. That is chronic inflammation and that is a killer. So there is a clear distinction between acute and chronic. We don't want your body to be in that chronic state of fight and flight, where it's chronically attacking something. As a result, it attacks your own body more often than not. Yeah. That's why you get Hashimoto's thyroiditis. That's why you get autoimmune diseases. That's why you get scleroderma. That's why you get psoriasis. Yeah. That is chronic inflammation. And you can't see it. And that's why we call chronic inflammation a silent killer.
Coming to a daily routine, and I'm only asking you because today there is so much of information, misinformation, guidance, wrong guidance that we are with all these reels and, social media, that one gets a little confused as to, okay, you have to set your routine, set your day wherein you become an optimally functioning adult.
Of course.
Or a human being.
Yeah.
Subah उठ के coffee तो चाहिए ही. I can't function without my first cup of coffee. What do you have to say to that?
I think any recommendation we give when it comes to health should be personalized. There is no all or none. So you might be okay with that cup of coffee. Most people are not, but most people are not aware that they're not okay.
So what do
with
you
it.
mean they're not okay?
Why do you need that cup of coffee? If I have to ask you a question in reverse, you need it because you want to wake up, because it gives you that caffeine rush.
Hit,
Why do you
yeah.
need that caffeine hit?
Yeah, exactly my point.
I always ask them to look backwards.
Hmm.
How did you sleep at night?
Hmm.
Did you sleep well? Didn't sleep well?
Hmm.
Most people will say, oh, we slept, but we woke up 3-4 times at night. Why did you wake up 3-4 times? Did you need to use the restroom? No, it's just a pattern. We just wake up. How long were you awake for? A couple of minutes? No, maybe 10-15 minutes, maybe half an hour. But why have you normalized this? You're not supposed to. Now let's go one step further. Why are you not sleeping well at night? What are you doing for the previous 3-4 hours for you not to sleep well? Is it a medical problem? Is it a hormonal problem? Is it a lifestyle problem? Are you having too much caffeine too close to bedtime? Are you eating too close to bedtime? Are you exercising too close to bedtime? Are you using too much, blue screen? So what is the reason? Do you have any thyroid issues? Do you have perimenopausal issues? Is your progesterone level down? So you have to break it down and go backwards and say, maybe you're not sleeping well. Hence, you need that coffee in the morning. So if you enjoy that cup of coffee, is a different thing. But if you say, I need my cup of coffee or I need my caffeine, that's a different thing altogether. So you need to figure out the why and the why for you. And that only happens when you go backward.
So you mentioned a few reasons as to why a person is not sleeping well, and sleep plays such a big role. One is, of course, taking caffeine too close to bedtime. How much time should there be if one enjoys a cup of coffee in the afternoon from the time you take coffee till bedtime?
So, if caffeine affects your sleep, it doesn't affect everyone. Some people are fast metabolizers, some are slow metabolizers. So, you have to notice, like I said, how it works for you. But if you look at the half-life of coffee, how long it actually stays in your bloodstream and affects you, is about 8 to 10 hours. That's a long time.
Long time, yeah.
So, if your bedtime is, say, 10 p.m. or 11 p.m., then you're looking at anywhere between 12 and 2. Most people enjoy their evening cup of coffee, 5 o'clock, 6 o'clock, right? So you need to see, does it make a difference to you? And the only way you'll know is abstinence. So you abstain completely for a while, and then you see, does it make a difference to your sleep or not? Chocolate has caffeine in it. Less, but it does. Tea has caffeine in it. I have patients who can't eat one piece of dark chocolate and go to sleep.
Oh, wow.
They're like, we're like an owl which is staring at the ceiling all night.
And that's because of one piece of chocolate.
I feel very sorry for those people, but it's one piece of caffeine.
Well, it's your metabolism.
Exactly, which is why personalized biology, which is why you need to see what works for you. That's important.
What about screens? Because I have friends who will complain that, I wake up and then I can't fall asleep. Then I start scrolling, and before, one knows it's like morning. Psychologically, it is so addictive.
Well, I think if I said 3 to 4 hours before sleeping, both you and me will be out of practice. And honestly, that's difficult to follow even for me.
Yeah.
I have worked very hard to get to a point where I personally don't watch my screen for an hour before. And I see that the shift it's made. It's a big shift.
Yeah.
I think 3-4 hours is pushing it, frankly. But if you can do it for an hour before, your melatonin level, your cortisol level, all will be in sync. These are all hormones that you need. Our body works according to a circadian rhythm.
Yeah.
So you need to set it right. Just by getting sunlight in the morning, you're not going to get, that's great, but that's not the only way, right? It has to happen through the day. So you need to, not just last thing at night, but also first thing in the morning. It also, because most people, get up and before you get out of bed, you're like, where's my phone? And like, what's happening? And you're scrolling, right?
Yeah.
So that's also a problem.
Why?
What are you doing? When you are doom scrolling, what are you doing? Whatever social cues are there, whether it is not very much good is happening in our country right now, but it all affects you. You're not beginning in the state of calm. So what have you done? You've activated your sympathetic nervous system.
Yeah.
That's the one thing I tell everybody. When you wake up in the morning, the first thing before getting out of bed, before looking at your phone, shut your eyes and just say your gratitude prayer. We don't want to begin our day on that flight and fright state. You want to begin with your vagus nerve activated. which
Yeah.
happens when you don't look at your phone.
Yeah, I think breathing calmly definitely helps. Our gratitude is also very, very good.
Yeah.
You mentioned food as well, not eating dinner very close to bedtime. Unfortunately, in India, we have this very bad habit of eating at 9:30 and 10. And when I tell people that, oh, I eat at 6:37, they're like, isn't that too early? And I'm like, no, that's how it should be. Uh, how do you counsel people and get them to eat earlier?
So one has to be very realistic. If I tell my patient 6:37 and you're living in a joint family where everyone's
It's not
eating at
possible.
9 and 10, they'll say, Doc, you don't know what you're talking about,
Yeah.
because it's something that's not
Yeah, yeah.
possible. So either I tell them not to sleep earlier, which is also not a
Not
great
good, yeah.
advice to give.
Yeah.
So I tell them, I said, whatever you're doing currently, try and just shift your dinner time half an hour before, and your sleep time, you just make sure you don't lie down for longer, right? So you're sitting erect, so you don't get GERD, you don't get your acid reflux, you're giving your body time to digest the food. You walk for 10-15 minutes immediately after, so your blood sugar goes down. But I can tell you that most advice that we give our patient has to be based on their lifestyle.
Of course.
So it's not what the textbook says. Textbook says 6-7 o'clock. Even I would love to eat at 6-7 o'clock, but it's not practical. We have very busy lives. I'm at the clinic till 8 o'clock. How am I going to eat
Exactly.
at
No,
6-7
you'll end
o'clock?
up, I mean, a lot of people end up traveling back home and they reach only at 8:30 or so. So it has to be very, very practical.
Yeah. So I find this practical advice for them. Anyone can make a half an hour shift here, sit up, walk for 10 minutes in the house. These are things that you can implement, and you can implement without disrupting your regular life. And that's important. But they will make meaningful changes.
Yes, of course. So in the morning when one has their first meal, how does one start? Because again, there is so much of information saying that, oh, you should eat protein, or you should start your day with fruit, don't have coffee first, like we discussed. According to you, what is the suggestion or recommendation that you will give your clients or patients?
The first meal that you eat actually sets the metabolic template for the day. That's important to understand, right? So what does that mean? It means the way you nourish your body with your breakfast, with your first meal, should be taken in a way such that you don't feel hungry and you don't crave rubbish later in the day. It gives you a feeling of satiety. So you don't want to eat for the next number of hours and looking
Nibble
for
here
rubbish.
and there.
Yeah. And what do we nibble? We nibble rubbish carb food.
Yeah.
Yeah. And also that it gives you that hormonal stability, doesn't cause your blood sugar and insulin to spike and then cause a trough. So you're looking at those things. Now, what kind of food gives you that? Protein with good fat. See, I don't know why, but Indians fear fat so much. They think if you're going to eat fat, you're going to land up with a cardiologist, you're going to have heart disease.
Yeah.
If you're going to have rancid fat, if you're going to have pro-inflammatory fat, of course that's going to happen to you.
Yeah.
But if you have good fat,
Yeah.
it's only going to nourish you, and your body needs fat for so many reasons. I mean, so you begin, say, with eggs, but with the yellow. So if you've got really high cholesterol, maybe make it one egg with the yellow, but one egg with the yellow is absolutely doable for anyone. Then you add the whites, or you add avocado on the side, or you add some nuts and seeds on the side. If you're going to begin your day with poha and upma, which is pure carb, what is going to happen? That's asking for a blood sugar and insulin spike trough. I mean, you're going to go into a hormonal dizzy. Then the rest, and it's so ironic, but if you take 10 men, women in 10 different rooms and give them different breakfasts, but ask them the same question, I can almost always predict with accuracy what they're going to say, how the rest of the day look like. The person who began the day, man, woman, who began her day with a pure bolus of carb, that could be fruit juice that we think is so healthy, if it could be fresh fruit juice, it doesn't matter, or if it is just poha or upma, will almost say, I felt really tired in the course of the day, I was sleepy after lunch, I'm not even talking about weight loss, that's a different thing. I'm at night I was craving junk food. It's almost a given that these people will complain of this. And when you tell somebody to begin with protein, to have your eggs, have your avocado, have some nuts and seeds, maybe some Greek yogurt, if they begin their day, they say our energy levels were really good. You know, we didn't feel hungry at all till
Yeah.
lunch. Maybe, you know, we had to eat lunch because it was lunchtime.
Yeah.
And we went through it. We went through our exercise. We went to the gym. All was okay. Had our dinner on time. Went to sleep. Everything on plan. Good day. Just because you're morning. So
Morning.
it reflects on your morning.
What is a substitute for eggs in case somebody is a vegetarian?
Like if you want to do, say, a moong dal chilla or a besan chilla. Now, all lentils and pulses are more carb, less protein. But at least they're not only carb, right? And then you put some fiber in there. So you
Yeah.
have it with some green chutney, or you have, you know, you just do...
You put veggies in.
Correct.
Chilla.
So you're getting your fiber. Or if you're doing even idli dosa, is rice plus dal.
Dal.
Then you add some sambar, which is your second protein. So you're
Yeah.
doing 2 proteins, 1 carb. Then you add your coconut chutney.
Yeah.
Now, you know, we have only 3 food groups.
Hmm.
But of all the 3 food groups, nothing balances your hormones and sugars more than fats do. So when you're having that South Indian meal with your idli, you're actually balancing your sugars and you're getting that feeling of satiety. So nothing wrong with that. So it doesn't have to be eggs and avocado. You know, you
Yeah.
can work around that narrative.
Yeah. Now coming to the 4 p.m. craving, you know, abhi chai chahiye, khakra chahiye, biscuit chahiye, khari biscuit chahiye. You know, you get that craving, that very strong urge. How do you combat that?
Well, first of all, your 4 p.m. craving doesn't start at 4 p.m. It starts with your breakfast.
Ah.
So if you've eaten a carb heavy breakfast, you are going to crave at 4 p.m. Right? But if you are going to eat a good breakfast, your lunch by default, though it may have the carb in it, and it should, it's going to still balance your sugar and you're going to crave that 4 p.m. 2 things will happen. One, you'll crave much less. So, and the quantity of what you eat by default then will be less. So it doesn't matter if you have to eat that 1 piece of khakra or some makhana or whatever. But if you're going to sit there with like a tub of popcorn and then say, I'm really hungry, it's 4 o'clock, I need my caffeine and I need my, you know, then you need to figure out, again, you have to ask the question why and look for the pattern. That is the single most important thing. What is the pattern? What have I done before? Why is this happening to me? So if you can understand that, you've set yourself up for victory because then you've understood your body.
Correct. You spoke about the glucose dip, the insulin spike and trough and all those things. Do you want to just take us through that, simplify that a little bit as to what it is and why spikes and troughs are not good? Why should it be relatively, of course, there will be spikes when you eat, but why should the spike be not that high?
First of all, why is blood sugar management so important? So first, when you eat anything, what happens in your body? Your blood sugar will go up. Now, to bring down the blood sugar, your body will secrete more insulin if it can. So then you get an insulin spike to bring your blood sugar down. Because if it didn't, we'll all be diabetic.
Yeah.
So you're using up more and more insulin to bring your blood sugar down. Now, when your blood sugar goes down, then your body gets very jittery and says, no, I need my carb. And it needs carb at that time because it's not used to that differential, right? And then what you're doing, you're going and eating more junk. That is setting up a metabolic template for metabolic disease. So when that happens, again, pattern, day on day, week on week, month on month, you're going to get that fatty liver. You're going to get insulin resistance, which is going to lead to diabetes, which is going to lead to heart disease, which could possibly lead to dementia, which is nothing but type 3 diabetes now. But if you begin your day in a way, you don't let your blood sugar go up like this and it goes up. It'll definitely go up a little bit. So it goes up like this, which means the insulin is also gone like this. So you're not getting those peaks and troughs. Then when you're like that, you're metabolically healthy. You're not going to get any of these diseases. So metabolic health is very, very closely linked to blood sugar and to insulin. It's also linked to leptin and ghrelin, but but they're all together. It's an interplay, right, of hormones. So you need to control that to make sure you don't get chronic lifestyle diseases. And it's honestly the simplest thing and it's totally in your control.
Yeah.
And I've done this for hundreds of patients. Now people who've been on insulin for 10 years are not on insulin anymore because you've just taught them lifestyle intervention. So sure, they might be on oral hypoglycemics and we might give them, metformins, and which is very good for longevity in any case.
Yeah.
But we are slowly tapering their medication by making them understand that the blood sugar and insulin needs to be in check. And that is in their control. So of course, it's through food. movement, like you said, is very important. There are certain supplements that can help with it also. So we give them that. Sleep, people undermine. They say, what is sleep to do with my blood sugar? One night of poor sleep, and you can ask any diabetic this, will tell you that their morning sugars are a good 10 to 15 points more. One night of poor sleep. Now, you do this day on day, week on week, month on month, exactly. So that's a big compounding effect. So you need to explain to them that. Now, if you have gut issues, then your gut is not able to digest food properly. We see ferritin deficiencies, B12 deficiencies, all of that. That there's an interplay of everything. So you need to make sure all of them work in sync together. And your blood sugar and insulin will come down by actually working through all of these.
So it's a complex system, but we need to pay attention to each and every system that there is. You mentioned supplement now, and you mentioned metformin. I just want to go a little bit off track because these kind of things are something that are of great interest to me because, again, it has anti-aging and reversal of aging effects on our body. Berberine is something that has become a trending topic today. Now, the worry also is that people in whom it is not indicated can get a drop in blood sugar very rapidly.
Of course.
With whether it's metformin or whether it is berberine. So how does one decide that, okay, this is something that is good for me, right?
You don't decide. Your doctor decides for you. No, it's that's the truth.
Yeah.
So just because your neighbor is taking it, your aunt is taking it, your sister is taking it, does not mean you can take it. If I tell you the number of people who come with side effects for different supplements just because it's a nutraceutical does not make it safe. We have people who come with bagfuls of nutraceuticals saying, why does my blood report look so bad? I take 20 supplements. I'm like, I don't want to see your supplements. Keep them down. Let's talk. But so people think it's the elixir of life, but you can't out exercise a bad diet. You can't out supplement a bad diet. And that's the truth. So just because berberine is touted to be a good drug, you can't be taking berberine and thinking that, oh, nothing's going to happen to me. You have to let your doctor decide for you. You can't have an HbA1c of 5 and then say, I want to take metformin or berberine just because I'm overweight. Because then what you said will happen. The person will collapse somewhere.
Which can be very, very dangerous.
Course,
right?
Of course. High sugars are acceptable, low are not.
Taking a step back and looking at our diet, Indian diet, we don't really eat too much of protein, right? It's very less. How do you incorporate protein on a daily basis, whether it is for me, whether it is for my child or my aging parents?
As a country, we are protein deficient.
Yes.
Right? Which is why we have so much of sarcopenia, which is why we're the diabetic capital of the world. Because if you're not eating protein, you're eating carb. And you're eating some simple carbs. So I'll tell you, for non-vegetarians, first of all, it's very easy to get their protein. If you do one non-veg meal a day and do eggs in the morning, you've reached your protein target. I don't even need to analyze what you're doing. More or less, you've reached. Now, unless you're someone who's looking into, bodybuilding and you want a six-pack, then it's a different. I'm talking about the normal Joe. For a vegetarian, because the source of protein is so incomplete and the bioavailability is not the same as a non-vegetarian protein, that's where the problem is. Also, then how much protein, how much dal, how much rajma will you eat?
Correct.
I can't tell someone to eat a bowl full. It's not possible. And then you will get bloating and indigestion and all those things that come with it. They're very difficult to digest because of the phytates, because of the oxalates. So you have to marry your vegetarian proteins well. Like, you know how we said idli dosa? That's a complete protein. So dal and rice are a complete protein because the amino acid profile gets complete. The ones that are deficient in one are there in the other. So that's a good bioavailable protein. Is it high carb? Absolutely. But we're talking protein and you will still meet your protein requirement. So when you're having rice, you make sure you're having a lentil with it, whether it's dal, rajma, chana, whatever it may be, if you're vegetarian. You begin your morning also, like we said, with your chilla and your thing. Sprouts are a very good source of protein. So every vegetarian, if you can tolerate, you should have a bowl of sprouts. And then, of course, you have paneer, you have tofu, you have nuts, you have seeds. All of those add up. But I can tell you, I find the easiest way for a vegetarian to reach their protein target is to take a scoop of protein powder.
I was just going to ask you, how about protein powders? But it is quite high in sugar, right?
No, not at all. Not at all.
Hmm.
There are you get protein powders. Most protein powders that are used by gym goers,
Hmm.
they barely have 5 to 7, 8 grams of carb
Hmm.
and 25 grams of protein.
Hmm.
So it's
So it kind
virtually
of
no
takes
carb.
care of your protein.
Yeah, because
requirements.
25 grams, if you look at most vegetarians, now this is especially a problem with the aging population.
Yeah.
Because as you grow older, you eat less.
Hmm.
Some people eat less, and these are real life problems that we see at the clinic. Some people eat less because they've got dentures,
Hmm.
and that's a real life issue.
Hmm.
Some people are genuinely sarcopenic and convalescent.
Ah.
So they are bedridden, they are, they can't eat so much.
Hmm.
We have to take into consideration all of this. And
Yeah.
I'm not even talking about cancer patients and stuff who can't. I'm talking about normal aging
Hmm.
individuals.
Hmm.
You need to make sure then you are giving them that protein powder, be it a plant protein or a whey protein, whatever they are comfortable
Whatever
with,
suits in, huh?
whatever suits their gut. So you give them that because that takes their protein intake to double. Most of
Hmm.
these people don't reach
No.
if you calculate, they don't get more than 25 grams of protein a day, which is
Hmm.
less than half, 1/3 of their daily requirement.
Hmm.
That's why you'll also see them like bent over
Stooped
like
and,
this.
yeah.
And
Loss of muscle mass.
yeah,
basically.
sarcopenia, which
Yeah.
happens, we lose
Yeah.
every year.
Yeah.
We're losing
Hmm.
muscle, bone, everything.
Yeah. Now coming to activity. Exercise again has become a big thing for whether it is sarcopenia in women at a certain age to, okay, I work out in the morning for 45 minutes and then having a sedentary lifestyle. As opposed to somebody who doesn't do maybe 45 minutes, but is active throughout the day, is not sitting in one chair and working. If given a choice, what would you choose?
So first of all, exercise and inactivity, they're not opposites.
Hmm.
I tell all my patients, don't just stick to your exercise timing. Choose movement.
Hmm.
Movement now has been shown to be far more important than just 45 minutes of isolated exercise.
Yes.
Yeah. So if you're someone who is doing your 45 minute of exercise, which is great, but then just sitting for 10 hours doing nothing.
Yeah.
I have so many executives who say we're just one meeting after the other, we're just sitting at the desk.
Hmm.
There's so much you can do at your desk.
Hmm.
So inactivity will cause your insulin levels to be, you'll have insulin resistance. You can have your blood sugar levels go down. It can reduce your metabolic rate. It can cause fatty liver because you can get visceral fat. Lots of things can happen. So ideally, you should choose both. You should do your 45 minutes of exercise and do what we call movement snacking now. So you must do that and do it every hour, even if it's just for 2 or 3 minutes. Also, after your meal, like I said, 10 minutes after lunch, after dinner, if you can just quickly walk in your room, well, your muscle is like a sponge for your blood sugar. So it will bring that down. So it means it'll make you more metabolically healthy.
Yeah.
You can do Surya Namaskars at your chair. You can do so many things. Now, the other thing is also something called NEAT, not the NEAT exams we're talking about right now, but it's
NEAT,
non-exercise. Yeah, it's non-exercise energy thermogenesis, which means not formalized exercise, right? So just movement of any sort. Like for me, I'm convinced that I maintain my body weight because I'm like NEAT on steroids. I'm like constantly moving my hands, my this thing, and that is form of NEAT, really.
Yes.
So for people who are very, very sedentary, I tell them do something. Just pick up something, pick up the glass of water, drink it, do whatever it takes.
Yeah.
But don't just sit there
Grow
on
roots.
front of your computer and sing and exactly.
So actually that's what I say, right? That being fidgety is actually a good thing.
Yeah.
Do something, keep moving, and the calories spent adds up. And it's amazing how much it does. And there have been good papers on this.
Yes.
So very important, guys. Just be active, be fidgety. Now coming specifically to women's health, which so far has been completely neglected. All the research that has been done is pretty much for men, and especially in the Western counterpart, right? Indian diaspora, we've not really paid attention.
Yeah.
What should a parent of a teenage girl keep in mind as to what she's eating, not eating, or the habits, so that she doesn't, because from what I hear, what I see, what my gynec friends tell me, that PCOS is on a rise.
I think it's absolutely key that every parent leads by example. So it's one thing to say, when you say, what should a parent tell a child? What should a parent guide? You may not necessarily need to. Instead of telling your child to eat more vegetables and have more broccoli, the child should see you doing the same.
Yeah.
You can't be sitting with a bowl of bhujia and then expecting the child. It's not going to happen.
Yeah.
Kids learn by example.
Yeah.
So that's what you need to do. So if you start at foundation level,
Mm.
then you are not going to set up for failure. If you are going to make, and I see this at the clinic very often when parents will come with kids and they'll say, be very quiet at the doctor's office and, we'll give you a piece of chocolate at the
So
end of
keep
it.
quiet.
And I'm like, oh my God, no, don't say that. Only because you are teaching that child that the chocolate is good for him or her. It's
a reward.
prized possession. It's a reward, right? But in India, we use food for everything. We use it as reward. We use it as punishment.
Yeah.
Both ways. And that is a problem. So that mindset a child should never learn. And that starts from home. You should normalize everything. Normalize the pizza, normalize the cake, normalize the healthy food. And eat it all as a balance. So let the child learn. Also, I find the other thing is, especially with younger kids, and I understand because parents get frustrated, but everyone's sitting with screens on the table.
Yeah.
But you're teaching your child not to understand the hunger cues. So the child tends to overeat much more.
So I think sitting at a dining table as a family itself is a great bonding event that one can create. Again, easier said than done. But this whole thing about giving a screen, because that's why I say that it's the cheapest nanny, is something that, again, besides the cues of hunger or whatever, you're not even letting the child enjoy the taste of different foods.
100%.
Correct? Plus, you need to chew slowly. You don't need to gulp food because that itself has so much of
repercussion on your digestion.
Yeah, exactly. Right. So very, very crucial. If there is one takeaway, I think this can be one that please don't use. And parents need to lead by example. You have to walk.
You have to. You have to.
Yeah.
And kids learn like that. And like you said, it also creates
bonding. We Indians also have this bad habit of saying, जो भी plate पे है वो खत्म करो. मम्मी मुझे भूख नहीं है. कोई बात नहीं. You have to finish. We can't waste food. What do you have to say to that?
Well, I tell every parent, first of all, parent, adult, whatever, I said, you please bring smaller plates in the house. No, it's the truth. Because we have such big plates and then we eat like this. Right? I mean, so if you start with a smaller plate and then fill it like this,
it still will be lesser.
You're still good. You're still better off. It's the simplest solutions. I always say, I find in life only simple solutions work. So when you throw a really complicated question at me and I'll give you this really simple answer, like, what just happened? But it's a workable answer.
One of my favorite statements in life, which I live by, is simplicity is complexity resolved.
Well said. Very well said.
So,
very well said. Yeah.
So, very crucial, guys, buy smaller plates.
Smaller plates. And there are studies. There have been studies done on this.
Of course, it's a psychologically proven fact, yes. We spoke about PCOS, and one of the reasons there is weight gain, or, your weight is above what is required for you to have. Besides losing weight, what are the other things that the woman or a girl can do so that the PCOS is on its track of going away?
Besides food? Workout, exercise. Now, most people with PCOS think that they should not lift weights. And that's such a misnomer because the testosterone level tends to be high in any case in the blood report, right? When you've got PCOS. So they think, okay, I'm going to lift weights. I'm going to build muscle. My testosterone is going to get, go higher. My androgens are going to get higher. I'm going to get more hair fall. I'm going to get more acne. This is wrong. Absolutely incorrect. You must lift weights. Your resting metabolic rate when you're sitting and not at the gym after you have worked out will help you drop the weight. More importantly, will help you drop fat, which is very important for any girl with hormonal issues. So you must exercise, must do a mix of cardio and weight training, but weight training is imperative. Absolutely. Then, of course, taking the right supplements, like I said. So be it, most of them have insulin resistance. So whether it is metformin as a medication or whether it is berberine or inositols, chromium, magnesium sometimes, they are all great supplements for PCOS and they help depending on what you've got. Zinc also is a great supplement for someone who's got gut issues, acne. So it really helps.
In foods, what are the do's and don'ts?
Whether you ask me about PCOS, you ask me about type 2 diabetes, fatty liver, dyslipidemias, the answer will almost be the same. Why? Because all chronic metabolic diseases are like different chapters of a same textbook. So they have the same underlying physiology, that of insulin resistance, that of high blood sugars. So you have to more or less, of course, then it's all precision medicine and individualized, but the basic stuff is the same. Knock off all your ultra processed food. Knock off your simple sugars. No liquid sugars. No honey, maple syrup, agave. It's good for me. My grandfather had it. No, wrong. It's not
Fruit
good for you.
juice?
Worst. It's only fructose, right? Nothing causes a spike. You should wear a CGM and just check what happens to your blood sugar. You'll know. You'll understand your biology. So eat the fruit with the fiber. Great for you. But don't have fruit juice. So knock off your simple sugars. Add your protein. Add your protein based on your body weight and not based on what the gym guy tells you to. And include your fat. Include your good fat because you want to balance your hormones. Also fat you need for absorption of your fat-soluble vitamins, for your immunity. I see so many people who are on zero-fat yogurt, zero-fat this, zero-fat, and they're constantly having coughs and colds and aches and pains. And when you do their recall, they have no fat in their diet. I'm like, there is
You need
utility for fats. It's not, you can't be, you just have to have the right fats. So you include their fats for them. And hydration is important. So you make them hydrate, whether it's with water, whether it's with electrolytes, depending on whether they're working out, not working out. And they're good.
When we talk about exercise, you did mention that, it is important for PCOS. And today, like I recommend it to my clients who are in perimenopause, menopausal age. Although I've not been successful with my mother, who's 75. She's like, Abhi kya karna hai? She leads a pretty active life, but she refuses to lift weights.
Ask her to speak to me. I'll convince her. I'm good
bring
with
her,
this.
I should bring her to you. So that is one aspect of it, that old people, it's very difficult for them to start lifting weights. The other part is that a woman, when she is going to get her periods, during periods, they don't want to work out. What do you have to say to these two groups?
Right before your period, eat a little more. If you're doing intermittent fasting, which is great for you, don't do intermittent fasting right before your period. Eat that little extra carb. So I tell everyone, while you are following a plan, this is your time. Eat that chocolate. Eat your extra carb. You want to indulge in something, eat it. Your body will allow for, the digestion to happen, all of it. And don't go very ballistic in the gym. Your exercise should be a walk, should be a 45-minute walk, you can't do HIIT during this time. You can't do OMADs, which are 1 meal a day. My God, I can't tell you the reports we see after these things. So you have to work according in sync.
Yeah.
You have to work with your physiology. You can't fight your physiology. Now, similarly, after your periods are over, what happens to our physiology? Our estrogen levels naturally go up.
Yeah.
During that time, if you want to do intermittent fasting, you want to do 16 hours, you want to do 18 hours, you want to do 1 meal a day, go for it. That's the time your body will allow you. Your energy levels will also be very high.
Yeah.
That's the time where you want to, do your HIIT workout, go for it. So you need to understand what to do when. And then you will see, not only will you feel very good, because honestly, that is the most important thing, not the way you look, but the way you feel. You'll feel very good. Your hormonal parameters will be great, and you will also manage to lose your fat if that is your objective. So all of it will happen. But if you're going to do exactly the opposite, then that's a hormonal chaos.
Yeah.
So you're asking for trouble. So if I have to answer in one sentence what you said, what you asked me, I'll just say, listen to your body.
And what about the senior citizen category? Where does exercise and carbs and all this fit into it?
So exercise can't be more important at this age, right? So even when people feel that we've reached a certain age, we're 70 or 75 and can't do it, nobody is asking you to, go into jumping jacks or burpees at that age, right? Which you should not actively do because you'll almost surely fracture yourself. But start small. Start with weight-bearing exercise. Start with walking. Start with walking. Start with 1 kilo weights. And whatever you do, I always say at that age, do it
Hmm.
under guidance.
Hmm.
You can't do it because form is way more important
Yes.
than getting injured.
Yes.
If your form is wrong, you'll get injured. Aditi, the most valuable exercise is the one that you're going to do a year later.
Hmm.
It's as simple as that.
Yeah.
I find in older people, what is missing is balance exercises.
Yes.
Balance is absolutely key.
Hmm.
Why do we want to preserve our bones? Why do we say, we want to prevent osteoporosis?
Fractures, right? I mean,
What
hip
happens
fracture
when we
is
get
one of
fracture?
the biggest reason for
Death. Right?
Yeah.
It's one of those top 3 causes of death in the
Death,
world.
yeah.
Most fractures happen when you slip, when you don't have balance.
Balance.
So I tell all my patients, please spend at least 5 to 10 minutes a day. That's all you
Hmm.
need.
Hmm.
Balance exercises.
Hmm.
Because even if you have weaker bones, for whatever reason, if you are far gone osteoporosis and you're 80-year-old and you can't exercise, if you strengthen, if you get your balance right, you won't
You
fall.
will not fall. Yeah.
If you don't fall, you're not going to get that fracture.
Correct,
So,
correct, yeah.
I'm only interested in the end goal.
Yeah.
How I get there
Yeah.
is irrelevant.
Yeah.
So no one's saying don't build your bone, but sometimes, again, I'm talking purely from experience of what I see at the clinic day in and day out.
Yeah.
There are people who are unable to exercise. For
Hmm.
those people, please do, because anyone, even you could be bedridden and you can do balance exercises.
Hmm.
So that you must do.
Hmm.
It'll prevent you from, having your falls and
yeah,
fractures.
yeah.
It's not-
Exactly.
I give conferences all over the world and people talk about longevity, and I always say it's not the length of your life, it's
Yeah.
your health
The
span, it's the
quality,
quality of your life,
Yeah.
right?
Yeah. Yeah. Yeah.
It's about adding life to your years, not years
Yes.
to your life.
Yes.
As
yes,
simple as that.
Absolutely.
And I'm a big proponent of doing vaccination. I think vaccines are a big thing, especially for the elderly population.
Hmm.
To do, your influenza vaccine, your pneumonia vaccine, herpes vaccine need be.
Yeah.
So those should be done because they can prevent a lot of things.
Yeah. Because in that population, they are vulnerable, right?
Of course.
And complications are very common from these, so to say, simple illnesses, which are normal.
Well, not simple. In a 70-year-old, if you have
No,
pneumonia
that's what I'm
or if
saying.
you
In that
have...
age, yeah. That age.
So
yeah,
anything
that's
that we
true.
can prevent,
Mm.
we like to do.
Now, there's this whole thing about 10,000 steps. That's become the golden standard for everybody that, I'm counting my steps. I've not finished my 10,000 steps. What do you have to say to this trend?
So I think walking just walking, when we're talking about walking, I think that's a great exercise, great mobility, and everyone should do it. I do it. But if you're asking me for longevity, is walking in itself great? And does that 10,000 mark work? It was just a random marketing thing done by, the Japanese for their pedometer.
Huh.
So there's no real science to that. That being said, the more you walk, the better. But science says that 7,000 to 8,000 steps are good enough. Good enough for what? Good enough for cardiovascular exercise. Great for BDNF, which is your brain-derived neurotrophic factor. So it's great for neuronal health, prevent dementias.
Yeah.
Is it enough in isolation for longevity? Absolutely not. Because it's not weight-bearing. You don't have any mechanistic load. And you need to then look into other parameters. And according to the American Heart Association, if you do 20 to 30 minutes of weight-bearing exercises, lifting weights for just 2 or 3 times a week, you walk for 150 minutes a week. And then if you do about 10 to 15 minutes of balance exercises through the week, that is good enough for you for longevity, to prevent death from the lifestyle diseases that we spoke from. So don't focus only on the 10,000 number. Focus on your strength training, your balance exercises, whether it's through yoga or just, calisthenics, or and then do your walking over and above.
So it should be a combination of strength, stamina, and flexibility.
Absolutely.
That's what I always say.
Yes,
That,
yes.
don't just focus on one.
Yes.
Strength training for women is very, very crucial, because there is still this whole feeling that women have that, if I go to the gym, I will develop
Bulk.
muscles. And I'm like, I wish.
Yeah, really, really.
It is so hard to get that
Yeah.
shape through
And then
weight
what
training.
happens post-menopause when you have that estrogen decline? You not only, lose out. Why are we so focused on that, right? Because the estrogen decline also weakens your bones.
Yeah.
So it's going to happen. It also gives you heart attacks. So that's why
Yeah.
women get more heart attacks than men
After.
after menopause.
Yeah.
So you have to be very careful being a woman, and you have to learn to
Lift. Okay.
That being said, I have to say, You could be a postmenopausal woman, you could be
Hmm.
60 or 70.
Hmm.
It's still not too late.
Hmm.
There's a study that just came out. Stacey Sims, this very famous exercise physiologist in New Zealand,
Hmm.
it's called Lift More, the study.
Hmm.
She did a study for 8 months
Hmm.
on women who were postmenopausal between the age of 65 and 70.
Hmm.
Okay, so that's way beyond menopause.
Yeah.
And just all that they did was 30 minutes of lifting weights
Hmm.
3 times a week.
Hmm.
And they found in 8 months, it started reversing their osteoporosis,
Oh, wow.
which is unheard of. We only
Yeah.
talk about preventing decline,
Correct.
slowing down decline, but this is reversal.
Hmm.
And then they also had another group who
Hmm.
didn't do it. So, and they had a decline.
Hmm.
It doesn't matter if you've never worked out all your life.
Hmm.
Doesn't matter if you're 40, 50, 70, postmenopausal. Today is a good day to start.
What do you say to a woman who is a little nervous about going to the gym? Because that's a lot of hesitation that one sees when a woman says, "Arey, main kaise jaun? I'm out of shape. Look over there in that gym, everybody is so fit." What do you have to say?
It's real.
Yeah, of course.
Absolutely, yeah. I would say go with a friend.
Hmm.
Maybe with a friend who is not so in shape.
Hmm.
So you have company.
Hmm.
And maybe go at a time when it's not filled with 18-year-olds and 20-year-olds who are in fantastic shape. So just choose an off-hour to start with. Maybe don't go to the gym.
Hmm.
Walk, do things at home, call a trainer home till you
Hmm.
get that confidence.
Hmm.
Build the confidence and then go.
A woman, actually, what happens is she's balancing through life. She takes care of the children, she takes care of her home. And then this thing is that I'm too tired to go to the gym.
This is because we are nurturers.
Hmm.
But I always say you can't pour from an empty glass.
Hmm.
So you have to first learn self-care
Hmm.
to be able to provide and to be able to do the best for the ones you love.
Hmm.
So you have to make that narrative shift,
Hmm.
which I actually see happening in today's day and age.
Yeah.
I see that women are understanding
Hmm.
that to be better providers,
Yeah.
you have to first take care of yourself.
Yes. Yes. Very, very crucial. Why did you decide to do Vipassana?
Oh. I wasn't expecting that question.
Hot seat.
I've been wanting to do Vipassana for more than a decade,
Hmm.
but I've just not found the time.
Hmm.
I had a milestone birthday coming up,
Hmm.
and I said, this is a gift I need to give
Oh,
myself.
lovely. That's the best gift you can give yourself.
Yeah. So I said, you know what? I've spent my life taking care of others, like
Hmm.
all of us women do. I said, this I want to do for myself.
Hmm.
And everyone said, it's your milestone birthday. Go to Paris if you want to do something for yourself. Why are you doing Vipassana? And I'm like, okay, Paris can happen. Paris
Yeah.
can wait. But this I need.
Hmm.
I need to go inward. I need to find a few answers.
Hmm.
Sometimes there comes a place in life where you're at a crossroad and you're not sure what direction you want to take.
Hmm.
I found myself there.
Hmm.
And I was hoping for some clarity.
And you got it?
Yes and no.
Okay.
Mm.
Okay. What was the biggest takeaway going inwards for you? And the reason I'll tell you why I'm
Hmm.
asking you this is also because so I have been a big proponent of Vipassana. I've done 11 10-day retreats, and others is like 3-5 day, 1 day here and there that I keep doing regularly. First few times that I went in with an agenda that this is my life problem right now, or this is something that I'm looking at a solution for. All that gets pushed aside, and completely different insights come to you. And then I realized after a few turns that, you know what, forget that. This is what I needed and this is what I got. So that has been my experience. However, Vipassana is such a thing that it just is a different thing for everyone. It's a different
100%.
form. It gives different insights, different experiences to everybody.
So for me, going inward has always been easy because I'm someone who, like I said, when the gratitude thing, I wake up in the morning, I meditate, last thing at night, I meditate. So for me, meditation, going inward has never been difficult, at least not for the last decade. The one definitive answer that I got was that I need to prioritize myself. That I was so busy trying to do everything else, whether it's family, whether it is clinic, whether it's friends, whether it's other aspects of work. I was so busy doing everything that I'd forgotten me.
Hmm.
So I think that's the one shift that I have started making.
Hmm.
How well I'm doing it or not, I don't know. But
Time will tell.
at least I have gone in that. I'm moving in
It's
that
the
direction.
baby step.
Yeah.
Okay, that's great. Going to gut health and microbiota, and how it is important to take probiotics, prebiotics. What are your thoughts on this?
I think there is a role and a place for everything.
Hmm.
Again, I think there is indiscriminate use of everything in the name of gut health now, because it's become such a longevity topic.
Yeah.
Our gut microbiome has trillions of different gut bacteria.
Bacteria.
We are actually 10 times more bacteria than we are human.
Yeah.
But it's like an Amazon forest, and you want all those species to grow.
Hmm.
If you're going to take one single probiotic or one single prebiotic in that supplement, what is happening over a period of time? You're growing only those species.
Yeah.
Those species are then going to become pathogenic species
Hmm.
because you are suppressing the other ones,
Hmm.
which is not what you want. You want them all to grow and all to work in conjunction, in
In
symbiotic.
symbiosis,
Yeah. So that's what you want. So when you're taking antibiotics, or when you've got a genuine gut issue, you've got loose motions, food poisoning, probiotics are great for you at that point. But if you're indiscriminately taking it, say, I'm going to eat a burger, I'm going to eat a pizza, I'm going to have refined food, but I'm taking my probiotics, so I'm good.
Huh.
That is asking for trouble. You're actually going to cause more dysbiosis.
Hmm.
So there is a place and time for everything. There's a protocol for everything.
Hmm.
Don't take things indiscriminately.
Hmm.
It's your health.
Which foods are, yogurt is one, of course.
Yeah.
But which are the other foods which you would say that, okay, take these are good for you, this is good for your gut?
Well, all vegetables that have high fiber are prebiotics, so those are great for you. As far as probiotics are concerned, of course, yogurt. You have your pickles, your sauerkraut, your kimchi.
All the fermented foods.
All the fermented food. Those are good probiotics.
There was this whole trend that had come into the picture, which was called colon therapy, where the gut microbiota was getting washed away. I think it still continues in some places. What are your thoughts?
So I don't understand this whole concept of detoxing a particular organ to detox your body. You know, people have these liver cleanses, liver detoxes. Our body is detoxing while we talk.
Yeah.
I mean, we need that for survival. Your skin is your largest detox organ. Your liver is detoxing itself. Your colon is detoxing itself. It doesn't need a push from outside.
Yeah.
For people who are badly constipated, who've got gut issues, do it the right way. Do it the natural way, through food, through prebiotics need be, through probiotics like we've spoken about, if required. Do a gut microbiome test. You don't need to push something in and to get all your... You know, I have seen one patient with a fistula in my life because of a colonic who had to be in hospital for a month. That is enough for me to shut books and say, I'm never doing this again. Rule of medicine, first rule of medicine, do no harm.
Yeah. Yeah.
So, not happening.
So, since you mentioned intermittent fasting, now one hears different angles that, oh, it is not good for women, it is not good for this, it's not recommended because hormonal health goes for a toss and things like that. Yet, you are a big proponent again of intermittent fasting. Why?
Because I know the health benefits it has, right? That being said, I think by now we have all established that I all say everything has to be personalized. So there are people I say, you can't do intermittent fasting. It's not meant for you. So it's not like this elixir that's there for everyone.
Correct.
Okay. As far as your question about women is concerned, like I said, pre-period, during period, please don't do intermittent fasting. Women with, say, thyroid issues, please don't bother even going close to an OMAD. It'll push you towards Hashimoto's. So there are lots of caveats and lots of do's and don'ts if you do it correctly. So while IF might be great for some, it may not work at all for some. So you have to, if it works for you, please do it. And even then there's a protocol of doing it. Like for instance, once you break your fast, people break it with a bolus of carb. Yes, it's not fasting and feasting, right? You can't, what is the premise of intermittent fasting? How does it work? Let's understand the basic physiology, right? You go into fat burning after 16 hours. So you have, why do you want fat burning? You want fat burning so that your insulin levels go low, you burn more fat, you don't have visceral fat and all of that. Now, after your 16 hours, if you're going to give your body a bolus of carb, you're doing the same thing. You're going from
Yeah.
there to there.
Yeah.
Defeats the purpose. So at
Yeah.
least break it with the right kind of food. Break it
Hmm.
with your protein and fiber. Then
Hmm.
have some carb. It's fine.
Hmm.
It's okay. But don't begin with a glass of juice. I'm feeling so tired. My 16 hours are over. I'm going to have a glass of juice.
That's going to
That's
cause
it.
more harm.
That's it. Like,
So what you're saying is use intermittent fasting judiciously. See if it suits you. If you have any medical condition, I think it's best avoided, or do it under then medical supervision.
I think anything related to health, medicine, wellness has to be done under medical guidance.
Okay.
I'm a big proponent of it only because I see too many things going wrong. Too many.
Oh, you have seen a bad case.
Multiple.
Okay.
Multiple.
With intermittent fasting?
Lots of it. I mean, people who just have black coffee, because they're working out on an empty stomach,
Hmm.
and then they get severe gastritis. I've had patients who come with ulcers because of it. And they're like, oh, but intermittent fasting is supposed to do me a world of good. I said, who have
Yeah.
you spoken to? Have you spoken to someone?
Hmm.
Have you consulted somebody? Have you told them you have a gut issue? Have you told them this is what you're doing? This is how you're feeling?
Yeah.
Don't give fasting a bad name, whether
Yeah.
it is IF, whether it is a one meal a
OMAD,
day,
or
whether it is
two
whatever
meals,
it is.
yeah.
Don't, do it correctly.
Yeah.
Then see if it works for you or not.
Yeah.
If you're going to do things indiscriminately,
Hmm.
you're going to pay a price for it. That's
Yeah.
the sad truth.
Yeah. What about keto diet, which is your fats and protein? Of course, there's zero carbs in it. How important are carbs for us, or should we all go on a keto diet?
If you're asking me from a medical standpoint, can you go on a keto diet and will it help you? The answer is yes.
Hmm.
Keto diets were originally discovered and used in kids who had epilepsy
Hmm.
because they were so good and they prevented a child from being epileptic.
Hmm.
So there was a medical reason for it and it worked.
Hmm.
My issue with keto diets is it's not sustainable.
Hmm.
If you tell me, Vishaka, you can never eat a slice of pizza again, I'm like, no, I don't want to live that way, or never have a slice of cake again.
Hmm.
Of course I do. Do I want to eat it breakfast, lunch, dinner? Of course not.
Hmm.
But I should be able to eat that occasionally when
Have
I
it, yeah.
And keto diets are very strict and they don't allow for that. They're unforgiving diets. So
Hmm.
it's one step forward. If you miss a little bit and you overstep a little in your carb intake, you go more than the 30 grams, you're starting afresh.
Again, yeah.
So they're very unforgiving. They also cause a lot of deficiencies in vitamins and supplements.
Hmm.
So then if you're taking it, you get copious amounts of hair fall. You have to take a bunch of supplements for different reasons. You don't have gut absorption.
Hmm.
And that's not a great way to live.
Yeah.
So that is my issue with the keto diets.
Hmm.
Carbs, as far as, you asked me, can we all go off carbs? Of all the three food groups, the one non-essential food group is carb actually, not fat, not protein.
Yeah.
So you could live without carb. You may not want to live that way, but you could live without carbs.
Mhm.
But you can't live without protein. You can't live without fat.
fats, yeah.
So the wrong one is vilified,
Unfortunately.
unfortunately.
What about water fasting?
I'm not a believer. I've had patients who've done it. First of all, never, ever, ever do water fasting without medical guidance. It has to be done under medical guidance.
Hmm.
But even then, now I've read a few studies about water fasting with cancers and some chronic diseases. I don't believe anything in extreme really works for our body.
Hmm.
I always say work with your physiology, don't fight it.
Hmm.
I don't think water fasts are natural.
Hmm.
I don't think these long fasts, you want to do it
Yeah.
as a one-off day. Fasting, we've inherited, right?
Yeah.
Irrespective of what religion, you go back thousands of years,
Yeah.
we've been doing it.
Yeah.
But extended water fasting, 7 days fasting, dry fasting, no, you can't brush your teeth and all. I find them very extreme and very
yeah.
harsh on the body.
Got it. So coming to the last section, which is a bit of a fun section, I would say, which is doctor and or versus internet.
Go for it.
Fresh fruit juice is healthy because it has no added sugar and it is all natural.
Hell no. Absolutely not. I mean, it's just nothing but fructose. It's a bolus of sugar. Over a period of time, it will give you diabetes, insulin resistance, fatty liver, maybe even heart disease.
Oh dear. Okay.
So stay away from it.
Stay away. If your fasting sugar and HbA1c are normal, your metabolic health is fine.
No, can be very misleading. You need to see trends. If your HbA1c is fine, but it's creeping up, that means you're beginning to get insulin resistance. So you need to check that as your test next or immediately. And if that is normal, then you're doing well. But if your insulin levels are also creeping up, Doesn't matter what your HbA1c is, that's misleading.
Mm. Intermittent fasting is beneficial for all women.
Far from the truth, very misleading, even dangerous, I'd say. Especially perimenopausal, menopausal women, women with certain hormonal issues like hypothyroid should do it. Well, everyone should do it under guidance, but these group of people more so, people with bulimia, with any eating disorders, absolutely should not do any sort of fasting. And of course, pregnant and breastfeeding women.
Jaggery, honey, and dates are a safe alternative to sugar.
Well, actually, the glycemic index of all of these is almost the same as sugar. So this is such a misleading fact that, you just have to, whether you're using sugar or whether you're using jaggery, I tell all my diabetic patients, if you really crave something, choose your sugar then. It's all right. But do it as an occasional treat. To say that you're doing jaggery because it's healthier or honey because it's healthier, doing you more harm than good.
That's not true at all.
Not at all.
Supplements or nutraceuticals are completely safe because you know what? They don't need prescription. You can go and buy them over the counter.
This cannot be further from the truth. Absolutely. We see patients coming in with multiple issues with nutraceuticals. Just because it's a nutraceutical, it's not safe. You're still putting something into your body. You're putting a chemical into your body. It's not, you're not plucking something from a plant. Remember that. It's still going through chemical process. So be careful with what you have.
Thank you for the quick rapid fire round. And thank you for coming on the Dr. Aditi Govitrikar show.
My pleasure. Thank you for having me.